I'm Dr. Keith Poindexter. Congratulations on deciding to begin your contact lens journey. I know that can be exciting and scary all at the same time. I want to reassure you of any horror stories you've heard about contact lenses typically are not true. You've heard people say the contact can roll behind your eye. Again, untrue. That the contact gets stuck or glued to the eye. Again, that is not true. The first rule of successful contact lens wear is that we wash our hands before we handle the lens. I tend to want to wash my hands with a non-perfumed, non-scented soap. And then when I'm rinsing my hands, I want to make sure that I get all of the soap off of my hands, especially the fingers that I'll use to handle the lens, which for me, being right hand dominant, is my right index finger as well as my right thumb. The other thing we want to do is we want to dry our hands with a lint-free towel because we don't want lint underneath the back surface of that contact lens. When we're inserting contact lenses and removing contact lenses, we want to keep the same batting order. In other words, if you put the right lens in first, then the left lens in second, same thing when we remove or vice versa. This helps us not confuse which lens goes into which eye. Contact lenses come in what we call a blister pack, which looks something like this. You'll see that's what we call the blister, and there's some foil on the front surface. What I want to do is firmly grab the blister side and peel the foil back. Some people like to just dump all that solution and the lens into the palm of their hand. Me personally, what I like to do is to reach in and kind of scoop the lens so that it's on the end of my index finger. Again, what you'll see me do is I'm going to transfer the lens back and forth until I have it in a side profile, such as this. As I'm looking at it from the side, I'm looking to see if it's in the correct orientation, and I'm looking for any edge defects as well. By correct orientation, I mean you're looking at the edges to make sure they go upward, kind of like a bowl, not flared outward like a saucer. This graphic will show you exactly what I'm talking about. When we go to insert the contact lens itself, again, being right-handed, I use either my ring finger or my middle finger on my dominant hand where the lens is located. And I go above the lower lashes to pin them against my cheek. With my other hand, I come above my head but get underneath the upper lashes to make sure I have complete control of my eyelids. And then as I'm looking in the mirror, I can put the lens right onto my cornea, the colored part of my eye. I'll roll my eye around some to remove any air bubbles. I'll let go and blink gently. Now that contact lens is seated appropriately. Another tip is to make sure you put your contact lenses in before you put any makeup on. Lots of times that makeup can actually get onto the contact and make the contact lens uncomfortable. If you didn't remove your contact lens from a blister pack and instead have removed it from your contact lens case, notice most are marked R and L or have different colors, usually green for the right side because green has 5 letters and the letter R, as does the word right. But if you've removed your contact from the contact lens case, you want to make sure that any excess solution, you dump that out into the sink. And what you want to do is you want to turn that upside down, let that air dry during the day, and then the next evening you'll be ready to use fresh new solution that night to disinfect your lens. When it's time to remove our contact lenses in the evening, again, we want to wash and dry our hands very thoroughly. And then we want to, again, come from above the lower lashes, pinning them against our cheek, underneath the upper lashes. And people do this one of two ways. Either they'll just go ahead and pinch the contact from their eye, or some folks like to slide the lens down and then pinch it from the white of their eye. But literally, not too difficult. Usually that's easier than inserting the contact lens. If you wear a daily disposable, you do what I just did, and that's throw that lens into the trash can. If you wear a non-daily disposable, then you have to clean the lens before you disinfect it. When we clean a contact lens, typically we'll have a disinfecting solution. The cap, of course, flips up like such. But to clean the lens, we're going to take the contact, put it in the palm of our hand. We're going to take some of that disinfecting solution and put into the bowl created by the palm of our hand. Then we're going to clean the lens, left, right, up, down, left, right, up, down. We'll flip the lens over, and then we'll do the same thing to the opposing side. Think of cleaning a dish. We want to clean both sides. We want to avoid swirling because that can put stress on the edge of the lens and create an edge defect. Once we've cleaned both sides of the lens, then we need to rinse both sides. So I like to put the lens on the edge of my finger and a few drops of solution to rinse that side. Again, think of your dish. After you've rinsed it, after you've cleaned it, you want to rinse both sides. Same thing on the other side of the contact. After we flipped it over, rinse that side. And that's when we would take the lens and we would put it into our lens case. Once it's in our case, if I can get it off my finger, then we add enough solution so that the lens itself is submerged. I like to shake the lens case because I don't want the lens itself hanging over the edge of the lens case, because if it does and then I screw the cap on, I'm actually going to damage the lens itself. Some other pieces of advice for a beginner contact lens wearing patient. You want to make sure you give yourself extra time in the morning if you stumble through the insertion process. So if you normally wake up at 8 o'clock every morning, wake up at 7:45 to give yourself that extra time. Same thing in the evening. Take the lens out well before it's actually bedtime. The worst thing you can do is, hey, I'm now tired, I'm ready to go to bed, and I'm having to fumble with the contact and frustrated that I can't remove it. Make sure that you discard the lens as recommended by your eye care provider. That's usually either daily, bi-weekly, or monthly for most lenses these days. Also, we want to replace the contact lens case if we're in a non-daily lens every 3 months or so. Those contact lens cases can get fairly grungy and be a feeding ground for bacteria. Also know that we don't want you to sleep or swim or shower in the contact lenses. If your eye ever turns red with pain, discharge, light sensitivity, decreasing vision, anything of the sort, we would want you to take the lenses out and see your eye care professional fairly urgently. Understand that rubbing your eye increases the risk that the contact lens is going to dislodge. Based on your particular eye anatomy, there are ways that you can rub your eye without dislodging that lens. You'll figure that out as time marches on. And rest assured, even though contact lenses can cause some issues, if you're doing your part and then your eye care professionals doing their part, the odds of those complications occurring are very low. Typically, contact lens complications are related to not complying with contact lens instructions and/or a poorly fitted contact lens. You can switch back and forth between glasses and contact lenses as much or as little as you see fit. Obviously, if you have a significant prescription, you want to make sure that you do have a good pair of quality backup glasses that you can use to see with in the remote chance you have to discontinue contact lens wear for a short while. That sometimes is due to infection, sometimes due to trauma, things of that nature. And if you have any questions about how to wear and care for your contact lenses, ask your eye care professional or their staff. Again, congratulations on beginning this contact lens journey. Hopefully we can keep you comfortable and clear in them for many, many years to come.